Well, welcome everyone. Thank you for taking the time to join Ripon Rotary Club, Fond du Lac County Health Department, and SSM Health Greater Fond du Lac Region virtual COVID-19 vaccine Q&A forum. My name is Liz Nevitt. I am the immediate past president of the Ripon Rotary Club, and I'm happy to be your moderator tonight. I have a few guidelines to share initially. This forum is being recorded in the event you would like to reference it later, or if someone would like to attend, who is unable to attend, would like to view the recording. All participants, other than the panelists, are being muted, so only the key speakers can be heard. Please submit your questions using the Q&A, which if you hover over the lower part of your screen, you will be able to see that function. I will read the questions so that anyone participating by phone will be able to hear those questions. Questions regarding the COVID-19 vaccines are welcome, as this is intended to be an educational session. Questions that are political in nature will not be addressed, and questions that are very specific to an individual's personal situation will also not be addressed, as they should be directed to your primary care physician to ensure privacy. We will start with a few common questions to get the conversation started. If a question is related to where, how, and when the vaccine is available, it will be answered in the Q&A box as opposed to live. We intend to end on time, so questions we are unable to answer during the live session in the Q&A box will be addressed later in a documented resource. We will now begin our provider discussions. We will start with Kim Miller, and we'll then have each of our guests introduce themselves. We are keeping introductions brief, so we will have enough time to address questions. Kim.
So good evening, everybody. I'm Kim Miller, and I serve as a health officer with the Fond du Lac County Health Department. The role of public health in the COVID-19 pandemic, specifically as it relates to the COVID-19 vaccines, is to really serve as that credible resource for vaccine information, provide and administer vaccines, especially to that underserved population, such as individuals that have a difficulty time leaving their home, as well as all eligible groups. As well as we do share the latest COVID-19 guidance and data that we receive from the state as well as federal agencies such as the Wisconsin Department of Health Services and the CDC. We also coordinate additional testing and vaccination opportunities for the community and work with different partners in our communities such as schools, nonprofits, as well as businesses to really meet that community need. This may include coordinating resources that we've been allocated to respond to the pandemic. Public health also spearheads contact tracing efforts, which has really been a proven strategy to help slow spread of viruses, especially viruses that cause COVID-19. Thank you.
Dr. Miller?
Hi, I'm Dr. Ted Miller. I'm an OBGYN physician practicing in the Fond du Lac area my entire career. I'm on this committee, I believe, because I'm currently serving as president of the medical staff for SSM Health Ripon Community Hospital.
Dr. Like?
I'm Dr. Jeannie Like, a pediatrician. I've been with SSM Health Ripon for 7 years, and I've taken care of kids in the greater Ripon area for over 28 years. I'm also the chair of the Green Lake County Health Advisory Committee and medical director of the Green Lake County Immunization Program. Over a long pediatric career, I have seen vaccines change the face of pediatrics and fundamentally improve the health of children. I talk to parents every day about the benefits of their vaccines and address their many concerns. So thank you for having me.
And Dan Wilk.
Thank you, Liz. I'm Dan Wilk, board certified ambulatory care pharmacist. I've had the pleasure of working with SSM Health over the past 4 years. My role is I collaborate with our primary care providers to help manage patients with a variety of chronic conditions on complex medication regimens. Being within primary care, preventative care is a big passion of mine, and I'm looking forward to serving on this panel to help answer any questions regarding the science and data behind the COVID-19.
Thank you. Before we begin taking questions, just a quick reminder, the Q&A forum is intended to be educational. So questions that are political will not be answered, and questions specific to an individual situation should be addressed by your primary care physician. We do ensure privacy in this situation. We will start with a few of the submitted questions that we got prior to the start of this session, just to get the conversation started. So this is to just a general question to whichever of you would like to respond. Is it possible to do antibody testing to know if an individual has unknowingly or knowingly contracted COVID-19?
I can take that one, or Dr. Miller, if you want to take it too.
Go ahead, Dan.
But yeah, as far as the antibody testing, so if we do antibody testing, it will help show if you've been exposed to the virus, because then you have produced antibodies to it. The problem is that there's not a set cutoff for us determining you have X amount of antibodies, and that correlates with guaranteed protection from the virus itself. We simplify it with antibodies, referring to antibodies as part of the immune response, but it's much more complicated than that. We have T cells and a variety of other immune cells that go into protecting us against the COVID-19 virus. And we don't have great ways of measuring some of these other cells involved in the immune response. So simply looking at antibody response, it's hard for us to take that and correlate that to or guarantee protection against the COVID virus.
I'll also add that if a test, any medical test, doesn't affect your treatment, then you have to question why order the test. And the antibody test would show if I or somebody else was unknowingly exposed in the past, but it would not change our management or recommendation. Even people that have survived COVID and have some degree of natural immunity still benefit from the vaccine. The vaccine, it turns out, all three had better protection, immune response, and protection against disease than the natural immunity, which is surprising to many people. So even if you know you've been positive, you should still consider getting the vaccine. And that's why antibody testing doesn't change our management.
And this question is for Dr. Like. If a child is 11 years old, but will be turning 12 soon, should they be given the child dose or adult dose of the Pfizer vaccine?
So the dosing is based on the child's age on the date of the vaccine. So as silly as that sounds, if you're turning 12 tomorrow, you get the 11-year-old dose today. There is no adjusting of the dose of the vaccine for height, weight, or other physical characteristics.
Okay, so it would not matter then how tall an 11-year-old might be. Is that correct?
No, they would get the dose that's appropriate for their age.
And another question, again, for Dr. Like, what is the risk to an 11-year-old male of getting myocarditis that has already contracted COVID-19 and then gets the COVID-19 vaccine?
Mm-hmm. So myocarditis is an inflammation of the heart muscle that occurs after many different viral illnesses, including COVID-19. In the post-approval follow-up, which was done very carefully, they noticed a slight increase in reported cases of myocarditis, especially in teenage boys who had received the second dose of an mRNA vaccine. Okay, that risk is estimated to be about 1 in 50,000. Okay. We know that COVID-19 itself is associated with myocarditis, probably somewhere on the order of 1 in 3,500 to 1 in 5,000. So your risk of getting myocarditis from the COVID virus is about 10 times higher than your risk of getting myocarditis from the mRNA vaccine. Right now, there's no data that suggests that having prior COVID-19 illness increases your risk of myocarditis following mRNA vaccine. So someone who's already had COVID should still be vaccinated.
Now I see that Dr. Kumar has joined us on the phone. Dr. Kumar, could you do a quick introduction of yourself? You are muted right now. Oh, there you are. So could you just introduce yourself real quickly to the audience?
Well, my name is Puneet Kumar. I'm a practicing internist and hospice palliative care physician. I'm also Vice President of Medical Affairs. I have been in practice for about 21 years or so. I believe most people in Ripon, Fond du Lac, Waupun area know me really well because I've lived and practiced here for a long time. And I'm a strong believer of the COVID vaccine.
Thank you so much. Another question that has been submitted is, how do I know there will not be side effects that show up months or years after receiving my vaccine? I'm not sure who wants to take that one.
Well, this vaccine has been around for more than a year, and as the most recent data is approximately 70% of the population has taken it. So, and even worldwide, there are hundreds of millions of people have taken it. If there were any unusual side effects, they would have shown up by now. And FDA is keeping a close eye on it. And people have an option, or health providers have an option of submitting any side effects of these vaccines online. And I occasionally go and check on some of the data being reported. So the vaccine has been out for approximately a year. At least, the first study started in, I want to say, May or June of last year. So it's been out for 1.5 years. We haven't seen anything unusual. I doubt that we will see anything in the future.
Dr. Kumar, the alternative to vaccination is to remain unprotected or less protected. What are the long-term effects from contracting COVID in the past 1.5 years?
Yeah, so, there is something that we are studying right now is prolonged COVID syndrome, which presents as fatigue, shortness of breath, lung fibrosis. There are all kinds of things which are happening that we are learning about post-COVID syndrome. I believe that is way more dangerous than a potential future risk of a vaccine, which so far has been extremely safe.
And here's a question. Oh, go ahead.
Looking back over almost 200 years of experience with vaccines, almost all the side effects from the vaccines occur within the first 6 weeks following vaccination. And that's what informs how long patients have to be monitored through the trials and things before they can apply for different levels of approval and licensure. Part of the problem with COVID is that it's so new. We don't understand the long-term effects of the disease, much less the long-term effects of the vaccine. However, with every other vaccine preventable illness, the long-term effects of the disease are far worse than the long-term effects of the vaccine.
And Dan,
I would
you
add
had a comment?
I would just add one more thing too. So the life of the mRNA and the particles from the vaccine, it's in the order of days to weeks. So it's not something that is sitting in your system for months and months and years. And so because of that, we really, you wouldn't anticipate long-term issues from the vaccines themselves.
Okay. And here's one probably for Dr. Miller. Is there any research on which type of vaccine, Pfizer, Johnson & Johnson, or Moderna, is better for pregnant women?
You may remember that when the first vaccine approval came along, the only people vaccinated at the very beginning were high risk. Most of us remember it was the elderly, but also people that had diseases that placed them at much higher risk for the COVID disease. And that list has always included pregnant women. Pregnant women have a natural decrease in their immunity. As everybody knows, if you're going to get a kidney donated or any other transplant, you want a perfect match. A sibling or a parent, a child would be the best, or somebody with at least your same blood type and tissue type. But when a woman is pregnant, her unborn child is half of her husband. Most of the time is completely different, or so much different than the mother, that a normal immune system would reject the baby and attack it. So naturally, a pregnant woman's immune system is suppressed so that she doesn't attack the baby. And because of that, she's much more prone to disease, any infection. And pregnant women comprise 10% of our society, but 20% of patients in the ICU with COVID disease. So we know COVID affects pregnant women more than their non-pregnant peers. All three of the vaccines are very effective at preventing. And a common question is, which vaccine should I get for any person, pregnant or not? And the answer is the vaccine they're offering you. That's the one you should take. They're all so wildly safe and effective compared to being unprotected that it's splitting hairs to decide I want the one that's 94% versus the one that's 91%. I would take whichever one's available. And because these age out, Dan will tell you, you can't just thaw out 10 doses of each and let them sit on the bench all day. You give one vaccine in the clinic or in that day, and you don't offer a choice because you don't want to waste them. Anything to add, Dan?
Yeah, no, absolutely. The logistics of it, you certainly, we got to, as a lot of health systems, kind of pick what we want to stock and what we want to be able to supply, but it's not like we're favoring one vaccine over the other. It's exactly what you're saying, Dr. Miller, with we want to use every little drop in that vial. We don't want to waste this precious vaccine. And to do that, it really, we kind of pick a vaccine for a given day or week and kind of stick with that. But all of them are excellent choices, proven to be effective, proven to be safe.
So another question is, they have said that if you started with one brand, you can get any of the other brands booster. Is that the case, or is it better to stick with the brand you first got? What are the thoughts on that?
Well, I do believe that FDA just recently approved mix and match. And you could mix and match, and there is some data from Europe that they believe mixing and matching is actually better for your immunity because these vaccines are just slightly different from one another. I think most of them are all directed against the spike protein on the virus, but maybe a different portion of that spike protein, that your immunity actually would be better. So I would mix and match. I don't know if Dan wants to add something to it.
Yeah, I exactly right. I mean, the studies are showing that if you boost with the same vaccine, you get a good response. If you boost with, say you take an mRNA vaccine and you get the Johnson vaccine instead, you're at least as equal as far as producing antibodies, if not even better success. So, how does that correlate to enhancing protection is where, we need more data to see. Does that mean, less cases if we mix and match, or are both just great? One or the other. And right now the recommendation is just with any of the three, really, any of the three that are offered.
So another question, I am eligible to receive a COVID booster dose. What is the experience showing in terms of how my body will take this dose compared to the reactions from the first 2 doses? Not sure who wants to take this one. Dr. Kumar, maybe?
So
It's administered many booster doses in her county clinic. Do you have any experience so far?
Yeah, we've done a couple clinics with the National Guard, and the information we're getting back is really just that, very mild symptoms, a sore arm, nothing much. And if you didn't have much of a reaction to, 1 or the first 2 that you had, depending on what type of vaccine you received, it's typical that you may not, have any symptoms, but, other than just a sore arm.
yeah, I would fully agree with that. I took my booster, I want to say about 2 or 3 weeks ago. I think after this, the first dose did not affect me at all, but the second dose caused a little bit of sore arm and chills for a day. And even with the booster, I had sore arm and chills for a day. I took Tylenol just once and it was okay. So the next day I woke up and I was fine.
And I would say, just to echo that, with the studies that are looking at this and the rate of the side effects and complications, it's either less or similar to when you would get your second shot from an mRNA vaccine. They're not seeing higher rates of side effects at all with these booster doses, realizing you're quite a bit away from when you got that initial series.
Mm-hmm.
Mm-hmm.
Just to clarify, some of you have mentioned the mRNA vaccine versus something else. Which ones are the mRNA and which ones are not?
mRNA stands for messenger RNA, and those were synthesized quickly after the genetic sequence was known. It was amazing worldwide cooperation. To many different labs around the world were working night and day to sequence this COVID virus as soon as it was discovered. And Moderna and Pfizer are the 2 currently available mRNA vaccines. Johnson & Johnson is a different technology. Moderna has fully invested in vaccination. The name Moderna is modified RNA vaccines, MO, and then they add the E, Moderna. And that's all they do. And they had 9 mRNA vaccines already completed against different infections when COVID hit. And all they needed was the genetic sequence of the new virus. And within days of other labs sequencing the virus, they had the new mRNA based on their established technology that they had on the shelf. And it was amazing speed. And then they immediately went into clinical trials. Some people are concerned about how fast this all happened, but it's easily explained by the amount of resources that were dedicated. I mean, the US government alone said, we'll buy 100,000 doses if anybody can get this to market. What company making vaccines wouldn't stop everything else? Let's quit making typhoid vaccine and let's make COVID. And the world was screaming for it, if you remember. But those are the 2, the Pfizer and the Moderna mRNA.
Okay. Is there anything that's showing that one is more effective than the other?
As I said before, they're both very effective. Pfizer is quoted, is shown in the experience to be 91% effective against symptoms in adults and 100% effective against symptomatic COVID in teenagers. Moderna is 94% effective in adults. But then the Delta variant came along, and the virus is mutating or changing because it's allowed to keep growing and replicating. This wouldn't happen if most of us were vaccinated, but it did. And this new variant is more contagious. An asymptomatic infected individual is able to infect 4 to 6 people before they find out they're positive, when the earlier variant was, 2 or 3 before. So it's spreading much quicker. But even against this more contagious variant, the Pfizer's 88% effective against symptomatic COVID and 96% effective against severe. And that was developed in the United Kingdom. And in Canada, they studied the Moderna. Each country has different access. In Canada, they found Moderna was 72% effective against the symptomatic and also 96% effective against severe disease. So even vaccinated people that happen to get COVID, you're nearly 100% protected against hospitalization or death. And some people reject the vaccine because it's not perfect. And there are very few things in this world that are perfect. But 96% is pretty darn good compared to 0 if you don't get the vaccine.
So along that same line, question, when the new flu variant comes out every year, we need a new vaccine. Why don't we need a new vaccine for the new variant, both Delta and the other variants that have shown up? Why don't we need a new vaccine for those?
Well, if you see, the influenza vaccine is a non-specific vaccine. It's made with a sort of different technique. You know, we grow the live virus in a chicken egg or duck eggs, and then the virus is isolated and boiled and killed. And so it's a non-specific vaccine. You know, you're getting basically a boiled, killed, inactivated virus, which changes frequently. But with the new technology, these vaccines are directed against the spike protein on these coronaviruses. And it's possible that the spike protein may mutate in the future, but this spike protein right now is not mutating as much as the virus is mutating. So because the vaccines are directed against the spike protein, they are really, really effective. And it's possible that we may need in the future a different vaccine, or if the spike protein mutates. Dan, you want to add something?
Yeah, I would just echo that. I mean, there's a lot of studies looking at antibody production to the variants of interest, and all very positive. The bigger concern is time from vaccine with that immunity waning, and that's why we're needing booster doses. Than Delta we're not protected from Delta because of the actual vaccines that were given. But I think it's true. It's something where it is possible that there are those mutations in the spike protein, and so eventually there may need to be a new vaccine, and that's something Pfizer has studied and is in production of trying to get to the. Is working very well, but we need to stay on top of this as the virus continues to change the game.
So I have kind of two sort of related questions. The one question was, am I more likely to transmit COVID if I am unvaccinated? And then a similar question, if I am fully vaccinated with a booster, does this prevent a person from spreading the virus to others? So they're sort of related. Not sure who wants to take that one.
I'll start and others will chip in, but if you wear a seatbelt, you're very well protected against serious injury, but it's not 100%. And it's way better than not wearing the seatbelt. And if you get the vaccine, you may be 80 or 90+% protected against contracting COVID, but it's not 100%. And anybody who contracts it is contagious, whether they're vaccinated or not. They're going to have a less serious infection if they're vaccinated, less likely to be hospitalized, almost certainly not going to die, but they can still get it and transmit it. Anybody who's got the active disease can transmit it. So that's why masks and distancing still are important, even if you're vaccinated, even if you've had a booster. We need to stop spread in every way until we get ahead of this.
So I guess a related question would be in regard to the masks, as you mentioned, Dr. Miller, many of the places we frequent, stores, that sort of thing, are saying if you're vaccinated, you do not need to wear a mask. Is that really the right guideline?
That's the CDC guideline, but I'd like to hear Kim weigh in on our local recommendations.
Because of fully vaccinated or unvaccinated individuals' ability to contract the virus, the Delta variant that's circulating currently, and have that ability to spread it to person, the recommendation is when you have at least substantial or high levels of COVID circulating in the community, that regardless of your vaccine status, individuals in an indoor public setting would be wearing masks.
Does anyone else want to weigh in on that one? Okay. Is testing being done to know which variant a person has? If we don't have or are not using a specific test, how do we know what is in our community? Maybe Kim, I'm not sure who's best able to answer that one. Or Dr. Like?
I can start. Okay, no, Dr. Like, go ahead.
Thanks, Kim. Of the samples that are collected, a certain subset are tested at the state laboratory looking for the variant. It's a very expensive and time-intensive process, so not every sample is tested, but some from our county go every month to be sequenced at the state lab. The reality is, across the state of Wisconsin, since the end of August, almost all the samples have been Delta, including the ones from Fond du Lac County.
Kim, do you want to add to that? Okay, all right. This is a child-related question. Is there a risk for getting a vaccine for a child who currently has a history of asthma? I assume this is versus not getting the vaccine.
Right. And I think especially for a child with asthma or an underlying medical condition, the vaccine becomes even more important. So if you have asthma or a developmental delay or a neurologic problem, your risk for getting pneumonia, getting hospitalized is significantly higher. And I'm encouraging the patients in my practice with asthma to really think hard about being vaccinated. For influenza as well.
And a related question would be, I have a history of reactions, severe allergies to other things in the environment, whether or not be vaccines. And for those patients, we recommend that they be observed for 30 minutes after their dose for any immediate potential reaction, but to still get the vaccine.
So in other words, it's more dangerous not to get those children with those underlying conditions vaccinated than it is to just get them vaccinated. Correct?
Most reactions
Yeah,
so far have been minor and short-lived.
Right.
And kids with other underlying medical conditions and medical problems really haven't been shown to have increased incidence of side effects, myocarditis, any of the other things we've talked about. But their risk from getting the disease is notably higher.
Excuse me. This is a somewhat long question. What long-term peer-reviewed... I'm sorry?
I was just to kind of add to that, the vaccine, it's not going to elicit a respiratory type illness. I mean, you might get a fever showing that you're having an immune response to the vaccine, but if you're coughing or if you're having a runny nose, those are not symptoms that would be elicited from the vaccine itself. So that would, if you're having that after you've been vaccinated, we should be looking into what type of illness that the vaccine wouldn't cause any particular pulmonary symptoms such as that.
Okay. Thanks, Dan. So here's this longer question. What long-term peer-reviewed studies can you direct the public to regarding the vaccine and fertility? There have been numerous reports of women experiencing missed periods, longer periods, prolonged bleeding, and women bleeding after having gone through menopause after receiving the COVID vaccine. What kind of research is being done on women who are experiencing these side effects? How can you guarantee this will not have an impact on someone trying to conceive? I'm assuming Dr. Miller.
I'll take that. There was a rumor started soon after the vaccine was introduced that women stated that they were now infertile. And for somebody who treats infertility, nobody knows they're infertile a week after any event. You know, there's no way to know your tubes are blocked or your sperm count is low or you're stopped ovulating unless a long period of time goes by. And most menstrual irregularities are quite common, and they're due to many times to stress or illness, and they're transient. That means they resolve on their own. So because somebody misses their period does not correlate with infertility. And there was a study done. There's no such thing as a long-term study on something that's been out a year. That's conflicting. But what studies we do have a clinic in the United States that studied all their in vitro patients, and they compared the ones that had been vaccinated to those that weren't. And they had exactly the same chance of getting pregnant and carrying a baby to full term. It's not a large study. It's under 200 women. But if there was a significant difference, I think we'd see it by now, because millions of women have been vaccinated, and there's no major organization that's recommended against women getting vaccinated if they want to get pregnant. We do know getting COVID has long-term effects, including hospitalization and tissue damage and death. You know, so the vaccine is way safer than contracting COVID. But no, there's been no study that's shown actual infertility in women receiving the vaccine. And ACOG, the American College of OB/GYN, and every other major organization recommends that women that are pregnant or hoping to become pregnant become vaccinated for their own safety.
Thank you, Dr. Miller. We have another question. What are we seeing in terms of the number of children who are being hospitalized for COVID? Maybe Kim, I'm not sure who wants to take that one.
Yeah, you know, I can probably speak for maybe the last couple months, but I would say, you know, a couple months ago, we were having probably 80 to 100 cases a day. And of that, there were probably a third of those individuals that were of child age 0 to 18. And probably now getting about 50 to 60 cases in a day. It's anywhere between 20 to 30. So, you know, a third to a half individuals are, you know, of that childhood age.
And so obviously those children would not have been vaccinated, correct?
Yeah, and you know, I do get reports of how many are ineligible to be vaccinated, and it's probably a third of that group that would be ineligible for vaccine.
And what we're seeing nationwide is that the average age of people getting COVID and the average age of people being hospitalized is decreasing. And it really reflects this large pool of unvaccinated kids who are driving that age down. So in pediatrics, we're seeing increasing number of kids infected with COVID. And alongside that, we're seeing increasing hospitalizations, not because Delta is any more serious or more likely to cause hospitalization, but because the denominator of children is so much greater that 2% of a bigger number is just more.
Now,
yeah,
go ahead.
I'll add in just a little bit. You know, when you look at, you know, the population of Fond du Lac County and the percent of the younger the age is, the less likely an individual is to be vaccinated. When you look at the individuals who are testing positive, it's really that group that has a less of a percent of that overall population being fully vaccinated. And also it is reflective of what we're seeing in the hospitalizations as well. You know, last year when COVID, when we were not dealing with that Delta variant, we saw a much higher age group of individuals ending up in the hospital, like at least 70s, 80s, 90s. Well, that group is very pretty well vaccinated percent wise. Now we're seeing a whole range of 20s all the way to 90s of individuals that are ending up in the hospital, overwhelmingly unvaccinated.
Right. At a recent hospital board meeting, we were notified that there were 20 patients hospitalized with COVID, sick enough to be hospitalized, and 14 of 20 were under age 45 without medical comorbidities, without other conditions that would make them at risk for hospitalization, and all of those were unvaccinated. So it is working its way down to younger and younger people.
We have had a question about who is Jace Como. Jace, would you like to quickly introduce yourself?
Sure. I'm the marketing manager here for the Greater Fond du Lac region of SSM Health. I'm not supposed to be on the screen. I clicked that I shouldn't be on the screen, but here I am. So
He is our tech guru who set all this up so that we can actually present this program. Another question, can children contract adverse health conditions by wearing masks? I'll open that one up, whoever wants to answer first.
Well, there is no evidence of it.
Yeah, there's been a lot of interest in that, and they've done a decent number of airflow studies, looking for things like rebreathing carbon dioxide, and that has uniformly been shown to not be a significant risk. So, and I think what's really important, especially in this season, as we head into other respiratory illnesses such as influenza or RSV, wearing those masks protects kids from those as well as COVID. So everybody stays healthier and everybody stays in school.
Is there a type of mask that is preferred over a different type of mask? We see different fabrics. We see the N95, KN95, the disposable types of mask. Is there anything that's preferred?
Well, some people will dismiss mask wearing because they're not perfect, and they'll quote studies that show people can still transmit disease through a mask, and it is imperfect. We wear masks in surgery. We all have my entire career, protecting me, but also protecting the patient from my droplets that would carry germs into the patient. And masks are very effective at preventing droplets, but they don't prevent a tiny virus particle. But most of these, when you cough or talk or sing or yell, you're spreading droplets, and the mask would stop that spread significantly. If we're actually taking care of a patient with COVID, then we wear a different mask. We call it a respirator. The N95 will filter out 95% of viral particles under a certain size, and it's tight fitting. It's uncomfortable to wear all day long, but that's what you do if you work in the ICU or the ER, because you really need protection. But to go to Menards or the grocery store, if everybody was wearing a paper mask, it would significantly reduce spread, not 100%. I did read a study done on hamsters where they had cages separated by mask material, and hamsters on one side were infected and the others were unaffected, versus another cage that was separated just by a screen, and significant difference in transmission to the unaffected by the mask material. So it does work. It's not 100%.
Well, I will say anecdotally,
Gaiters made out of cloth are probably the worst material to use.
I would say anecdotally, my experience is that I was exposed to COVID patients who were diagnosed after the fact. You know, they came to see me, they had a first negative test, but they were still having symptoms, and I saw them just wearing a paper mask, you know, the regular surgical mask. And I was exposed at least 3 or 4 times, and I did not get COVID even before the vaccinations by just wearing a simple mask. And I examined them, I examined their throat, I even collected the neck swab wearing just a paper mask and gloves, you know, and just hand hygiene and paper mask, I would say, is really, really effective. It's underrated. But from my personal experience, it's extremely effective.
There was a widely publicized observation where 2 hairdressers were infected with COVID, and they were wearing masks at work, and not one of their clients contracted the disease. But unfortunately, their family members all did because they were unmasking when they got home. So the mask made a noticeable difference in the spread.
We had a very specific question. It says the Pfizer COVID distribution study, I suspect, performed in Japan show the lipid nanoparticles used to transport the spike protein in both Pfizer and Moderna vaccines deposit in the ovaries. Do they not disclose how it can be safe for girls and pregnant women when long-term studies have not been performed on this population? Anybody want to take that one?
Absolutely. The mRNA is the technology that allows it to absorb into your body. It's dissolved in lipid or little fat molecules. They're so small, they're called nanoparticles. And there was a study done in Japan where they measured different tissues in rats that were given 1,300 times the human dose of the vaccine to see what tissues absorbed it. And let me get to my notes. After 48 hours after the injection, 25% of the material was still detectable in the injection site. The next highest tissue was the liver, which metabolizes everything in our body, and 16% was located there. And in the ovary, it was 0.1%. It was 1/10 of 1% was noted in the ovary. But somebody who's against vaccines cherry-picked that number and spun it around to say it's concentrated in the ovary, which it's clearly not. It's almost undetectable. And there's no reason that it would have any long-term effects. When you understand the science of messenger RNA, it doesn't interact with DNA. It doesn't get into the cell nucleus, which contains our DNA. It only gets into the liquid part of the cell called the cytoplasm, where proteins are made with what's called mitochondria. And so the mRNA instructs the mitochondria to make this spike protein and help us develop immunity to that part of the virus. But it doesn't get into the DNA, and it doesn't interact with our DNA. And as Dan pointed out earlier, the mRNA is cleared from our body between hours and days after it's seen. We have no scientific reason to expect that trace amount in any tissue is going to have a long-term effect. And they're actually measuring just the lipid that brings the mRNA, not the mRNA.
If children have a recovery rate of 99.9%, why are they recommending the vaccine that has a 10% myocarditis chance?
10%?
Okay.
If that's the question, I'm just reading it.
That's all right. That's all right. Yes, for the most part, kids do well with COVID, but the risk of myocarditis from the vaccine is 1 in 50,000. So we're talking a less than 0.001%, not 10%. Okay, but it's tenfold higher if you get COVID itself. Even though most kids recover uneventfully from COVID, there's still quite a few who are very ill at home, who have pneumonia, few who need oxygen or hospitalization. We also don't know much about long COVID in kids. There appears to be some risk of that. Children kind of uniquely have this post-inflammatory syndrome with COVID that is rarely described in adults, but is known to occur in children. And so all of those risks are significant. So the vaccine itself is safe, it's effective, and the risks from the vaccine are far lower than the risks from getting the disease itself.
So I have more of a comment, I guess, than a question. It says to have a true debate, not all, I assume, panelists should be from the same organization, meaning SSM. Start saying where you are finding your resources, that would be helpful. So if there are specific studies or any websites you can recommend to our viewers, that would be helpful.
I think
I go to the
anyone,
And
internet.
maybe,
I go to the internet every day for things that I need more information on, but I'm careful to go to reliable sites that I can trust, you know, sites that have a reputation for being accurate. It's not the same as Googling.
and can you
or
say
Facebook.
some of those? Can you specify some of those, Doctor?
Well, the
Some of those
Fond
sites
du
that
Lac
are
County,
trustworthy?
Fond du Lac County Health Department is a very well organized, comprehensive site. What should I do if I'm exposed? What should I do if I test positive? What should I do if, you know, it's easy to understand. It's very comprehensive. These are people that have dedicated their careers to helping the public manage their health, and you can trust them. And the Center for Disease Control, I understand there are people that, because if it's government associated, they don't trust it, and it's hard to respond to that unless you think everybody's against you somehow.
Well, I would recommend even mayoclinic.edu or Cleveland Clinic. I want to say it's clevelandclinic.edu, but it's not. I want to say it's clevelandclinic.com.
Mayoclinic.org.
Yeah, and there is Medscape. Some of these things are peer-reviewed and legitimate sources. You know, even uptodate.com has a area for public. It is the site that we use. I use it almost on a daily basis, but that's for healthcare professionals. But there is an area that you can go on as a public, and there is a lot of information on that website. I would avoid Facebook or some of the social media just because some of this information is hijacked by the anti-vaxxers.
And a true debate doesn't mean you need people of opposite opinions. I understand what that means, but the point here was trying to get people that are experienced and knowledgeable, a pediatrician, a pharmacist, a hospitalist, an OBGYN for questions about infertility. You're not going to find a variety of OBGYNs that differ on the recommendation to be vaccinated. You're not going to find hospitalists that take care of COVID patients disagree about the value of vaccine, and you're not going to find public health nurses that are not in agreement. You're going to find people that work in our society in a variety of jobs that have no background in science and don't know how to interpret statistics or literature, yet they have a microphone on Facebook, and yeah, I compete with that all the time in my practice.
Well, I have another. Go ahead.
One of my favorite resources for immunization information is the Vaccine Education Center in Philadelphia. This is an independently funded organization. It's certified by the World Health Organization for vaccine accuracy and transparency. It is a very deep website with all kinds of information. And if you want to drill down, it has a lot of really reliable links as far as vaccine ingredients, safety data sheets. There's a lot of good information there about what is supported by science, what is expert opinion, what is still under study. Their website is vaccine.shop for Children's Hospital of Philadelphia.edu. The FDA has been really transparent about the data regarding COVID vaccines. And I spent some quality time earlier this week doing the deep dive with the information regarding 5 to 11-year-olds and COVID vaccine. So if you can read the biostatistics, if you can understand the virology and the epidemiology, it is all there on the FDA website. And you can read the real source data about who participated, what underlying conditions they had, what countries they were living in, how many got myocarditis, how many got sore arms. It's all there if you want to do the deep dive, and you can read the source data.
And we are getting closer to our time. I have a couple really good questions here yet. How do I know if my children have allergies, COVID, or the flu?
Okay. Yeah, they can all kind of look alike as far as runny nose, stuffy nose, and cough. Allergies tend to have more eye involvement and more itching. Viral infections tend to have fever, sore throat, often decreased appetite and other symptoms. But it can be really tricky and to know whether it's allergies or a routine cold. So if you're not sure, contact your healthcare provider or consider getting tested.
Okay. Another question, it says back to the mRNA protein. Does this interference affect your natural immune system fighting other diseases?
Can you repeat that question, please?
It says back to, or referring back to the mRNA protein. I'm not sure it's protein, but in any event, does this interference affect your natural immune system fighting other diseases?
No, I mean, it is, so we don't live in a sterile environment. You know, you are being exposed to millions and billions of viruses and bacteria every day, and your body's constantly fighting, your immune system is constantly fighting. Even your GI tract, your upper respiratory tract is not sterile. So exposing your body to one more antigen in a small dose really does not lower your immunity in any other way. So I don't know if Dr. Like wants to add something.
Yeah, the mechanism of the mRNA is such that it stimulates the immune system by showing it something that's foreign, but it doesn't fundamentally change it, nor does it make you more susceptible to other diseases.
When should a person receive the vaccine, the COVID vaccine, after having tested positive for the virus? I'm not sure who's best to answer that one.
Dan.
In general, they should be fully recovered from COVID. So their body aches, fever, and cough should be fully resolved. If you've had a significant complication from COVID, for example, kids who've had the multi-system inflammatory syndrome or another significant complication, they should wait 90 days.
And don't hesitate to reach out.
They should still be vaccinated.
Don't hesitate to ask your doctor, you know, the person treating you for your positive test, what to do next.
And I know sometimes it can be hard to get in to see your regular doctor. Maybe there isn't an appointment. Dan, can you, as a pharmacist, how do you respond to people? Sometimes pharmacists are a bit more readily available to the public.
Yeah, I mean, I work in a little bit of a unique practice setting, being kind of immersed within primary care, but that is it's an option, obviously. We have a lot of telehealth opportunities out there. Pharmacists can be able to kind of triage certain things to the providers at hand. And also a lot of these pharmacies are able to test for things such as the COVID virus. So if it's tough to get in with your provider, or if you're not sick enough to where you feel like you need to be seen, there are testing availability, and Kim obviously is well versed in that too, through the county, of being able to get tested to confirm what is going on. Is this COVID, or is this the run-of-the-mill cold? So definitely utilize all of your resources around you.
So Dan, if you, as a pharmacist, if you were to receive a call saying, hey, I can't get into my regular doctor, I've got this symptom and that symptom, what should I do? Is that something that you can address at all, or would you just refer them back to their provider?
We would refer, look, our specialty, our doctorate is in treatment, right, is in medications. And so we're not trained as pharmacists in the diagnostics of kind of diagnosing a condition. So we obviously understand the conditions and we understand when to triage something or pass something along to a provider. But we're not ones to make a diagnosis. Don't let a pharmacist give you a diagnosis. We need a medical doctor or a advanced practice provider to do that for sure.
Yeah, and we're happy to field those questions over the phone or through my chart, or they come to us in a variety of different ways. But I want to reinforce this concept of how important it is to be vaccinated, even if you've already had COVID. So that's something that I come across almost every day. We've already had it. We don't need to worry about it. Why would we even bother with the vaccine? But we know that the vaccine immunity is much stronger than the natural immunity, and especially the people who've had both. So who've had COVID and have been vaccinated, they've seen that virus in multiple different ways. So their immunity is stronger, but it's also more flexible against the variants. So when you have that type of dual immunity, you're going to fare better as new things come down the line.
And again, we are
Liz?
getting close. Oh, go ahead.
Can I address, there's also a question about the reported symptoms of the vaccine. And there is a reporting system called the Vaccine Adverse Event Reporting System. Anybody can report anything to this site, and it does not prove cause and effect. But people monitoring the site are trying to find any pattern that might be attributed to the vaccine. But because something happened when you wore a green shirt doesn't mean the green shirt caused that something to happen. And anything that anybody's illness or event that happened after the vaccine may not have been related. So we're watching for patterns. And in Europe, they found 5 younger women that had a very rare bleed in their brain after the J&J vaccine. But that was after 5 million doses had been administered, and 5 women got this very rare, serious complication that is literally 1 in a million risk. So those sites are monitored, but if somebody quotes you as 1 million side effects, they're misinterpreting this site as it's not cause and effect. It's not anything that's necessarily attributed to the vaccine. It's just somebody reported, I felt this or I experienced that, and they're watching for any pattern that might actually be due to the vaccines. Thank you.
And I know we are pushing right up against 7 o'clock. I did get a question about the use of ivermectin. Does anybody want to take that one, that it's been used in other countries, and why are we not using it here?
So let me just talk about that, because there's some comment in there that Japan and India used it and eradicated the virus. It's definitely not true. My entire family in India had the infection, and actually 2-3 of the people died. One of my older uncle died, my wife's uncle died, and they were given all kinds of things. They were all given ivermectin. They were given the malaria medication, the Plaquenil, the hydroxychloroquine. They were given these very, very high doses of steroids. They are really not effective. There is no proven benefit. And let me say that from personal experience. I want to say at least 50 members of my family received ivermectin in India. It did not help them. In fact, ivermectin is a neurotoxin. It's given to dogs and cattle for hookworm infestations and other things. If you get the dose even slightly wrong, dogs have seizures. And the dose is a little difficult to calculate. And there is no proven benefit of this therapy. And I can't emphasize that enough. It's serious. People think ivermectin is this candy that they can take. And I tell you, it's extremely serious medication.
If it
Dan,
worked,
did
we'd
you
be
want to?
using it.
Yeah, I would just add a little bit. We're searching for treatments. I mean, we're definitely searching for treatments. The problem, ivermectin in the test tube environment is proven to stop some of the entry of the virus into the cells. But when you look at it into a human body, you need about 1,000 times the normal dose to reach that concentration that you would get into that test tube environment to stop COVID. And as Dr. Kumar pointed out, you're reaching neurotoxicities even around the dose that you would normally treat somebody with. So going 1,000 times above that would certainly mean an improbable death for that person, unfortunately.
So in the end, it sounds like if someone has a question about the treatment for COVID, those sorts of things, talk to you, their physicians or pharmacist to find out the best treatment for them specifically, correct?
Yes.
Okay. We are actually a few minutes after 7. We are obviously at the ending time. I want to thank all of our panelists. I want to thank everybody who has joined us tonight. We've had quite a large group joining us, and thank you for your questions. Thank you for your participation. Again, this has been recorded and will be shared through SSM Health, the Fond du Lac Health Department. I know as far as Ripon Rotary, I will do my best to get that posted on our site as well. But please stay safe. Help us use the vaccines as they were intended to help us return to our normal lives. With that, thanks everyone for being here. And I wish you all a pleasant rest of your evening. Go Packers.
Thank you. Thank you for having us.
Thank you. Yes.
Thanks, Liz, and thanks, Ripon Rotary.
You're very welcome. Again, everyone have a lovely evening.